I'm Becky and I'm a neonatal nursery nurse in a neonatal unit. So to look after special care, premature and poorly babies who no longer require intensive care or high dependency, support the paediatric and nursing team, monitor babies' oxygen saturations, their heart rate, their respiration rate, their blood pressure, temperature, their weight, and make sure that it's all recorded, to keep appropriate records of all of that and report any abnormal or deterioration to the nursing and paediatric team. I can take babies' bloods via heel prick, so that could be for their blood sugar levels, their jaundice levels, their infection markers. I can also care for babies who require phototherapy treatment for jaundice if their levels are high enough to need treatment. I can feed babies via nasal gastric tube, which goes into the nose and down to the stomach, by cup and by bottle, and support parents with this and their choice of feeding, such as breastfeeding or bottle feeding. There is a lot of feeding support involved. Care for people's personal hygiene, so nappy changing, washing, bathing, and also mouth care, and encourage parents to do this and support them with doing it, and helping to admit and discharge babies. The role will probably vary in different hospitals. Where I work, this is what I do. So they're 12.5-hour shifts. It could be days, nights, weekdays, weekends. The pattern does vary week to week. We have a morning handover with the team, and then we have a bedside hand, both the patients that we're looking after that day. Be involved in the consultant ward round, where the progress of the babies is discussed, and a plan is put into place, and we encourage parents to be there as well, so they can be involved and in the care and planning of their baby to get them ready to go home. Most babies are fed on a 3-hourly basis, sometimes 2 or 4 hourly, and that continues throughout the day, overnight as well. Again, like I said, my responsibilities, a lot of support for parents with feeding, changing, caring for their babies, equipment checks as well, and stocking up and cleaning. So I did my BTEC National Diploma in Childcare at college when I finished school, and then went on to work in 2 different nurseries over a 10-year period, where I was a nursery practitioner, then a lead practitioner. I felt like I needed to do something else and challenge myself a bit more, so I looked at what else I could do, and I liked the idea of working in a hospital, and I just happened to come across the job and I went for it, and here I am. So a level 3 in childcare. Hospital experience is preferred but not essential. I didn't have it and I'm in the role. You need to be caring, compassionate, accountable, respectful, and a good listener. Good communication skills, written and verbal, because a lot of stuff you have to document and it needs to be clear so it can still be read. Knowledge of safeguarding, as well as being able to work within a team and independently. Be able to stay calm under pressure and manage a workload effectively. Seeing the babies develop and grow to be able to go home with their families, and the helping and supporting families is good as well. I enjoy that. It can be very busy at times. Sometimes you can end up with a bit of a bigger workload, depends what's going on if there's an emergency. It can be demanding, but as long as you can manage your time effectively and prioritise what needs to be done, you just go with it. Try and get some hospital experience if you can by volunteering. Don't think you just have to stay in a nursery when you've got your qualification. There are other things you can do, and don't be afraid to go out of your comfort zone and try something different.